Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at New Webinars, and YouTube at tinyurl.com/newwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and/or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Pi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram.
Orasyo Imperata para sa proteksyon laban sa COVID-19 virus. Mahabagin at mapagmahal na Ama, nagsusumamo kami sa iyo upang hilingin ang iyong patnubay laban sa COVID-19 na nagpapahirap sa marami at kumitil na ng mga buhay. Tunghayan mo kami ng may pagmamahal at ipagadya kami ng inyong mapaghilom na kamay mula sa takot sa kamatayan at karamdaman. Itaguyod mo kami sa pag-asa at patatagin sa pananampalataya. Gabayan mo ang mga dalubhasang naatasan na tumuklas ng mga lunas at paraan upang ihinto ang paglaganap nito. Nagpapasalamat kami sa mga bakunang naisulong sa patnubay ng iyong mga kamay. Pagpalain mo ang aming mga pagsisikap na mawakasan ng mga bakuna ang pandemya sa aming bayan. Patnubayan mo ang mga lumilingap sa may sakit upang ang kanilang pagkalinga ay malaki pa ng husay at malasakit. Pagkalooban mo sila ng kalusugan sa isip at katawan, katatagan sa kanilang paninindigang maglingkod at ipagsanggalang sa karamdaman. Itinataas namin ang mga nagdurusa. Makamtan nawa nila ang mabuting kalusugan. Lingapin mo rin ang mga kumakalinga sa kanila. Pagkamitin mo ng kapayapaang walang hanggan ang mga pumanaw na. Pagkalooban mo kami ng biyaya na magtulong-tulong tungo sa ikabubuti ng lahat. Pukawin sa amin ang pagmamalasakit sa mga nangangailangan. Sa pagdamay at malasakit namin sa bawat isa, malampasan nawa namin ang krisis na ito at lumago sa kabanalan at pagbabalik loob sa iyo. Hinihiling namin ito sa pamamagitan ni Hesukristo na nabubuhay at naghaharing kasama mo at ng Espiritu Santo, Diyos magpasawalang hanggan. Amen. Dumudulog kami sa iyong patnubay, mahal na Ina ng Diyos. Pakinggan mo ang aming mga kahilingan sa aming pangangailangan at ipag-adya mo kami sa lahat ng kasamaan, maluwalhati at pinagbalang Birhen. Amen. Mahal na Birhen, mapagpagaling sa may sakit, ipanalangin mo kami. San Jose, ipanalangin mo kami. San Rafael Arcangel, ipanalangin mo kami. San Roque, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM live stream. The title of this forum is Public Cervix Announcement, a forum on cervical cancer or Kanser sa Kuwelyo. Ano nga ba ito? Today's forum aims to give us an overview on cervical cancer, its risk factors, signs and symptoms, diagnostic approach, and treatment. For today's forum, we have Dr. Gladdy Maura Facun, one of the authors of OB-GYN Pearls, a fellow of the Philippine Obstetrical and Gynecological Society, a diplomat of the Society of Gynecologic Oncologists of the Philippines, a member of the UPMA's Board of Directors, and an active specialist in various medical institutions in Region 1 as our moderator.
Mommy, start na ako. Hello everyone. Welcome once again to Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. I am Gladdy Maura Facun, UP College of Medicine and Mu Sigma Phi Sorority Batch 2011, your host and moderator for today. This event is brought to you by the Mu Sigma Phi Sorority, Mu Sigma Phi Foundation, the UP College of Medicine, Philippine General Hospital, and the City of Manila. This forum is a series of panel discussion that aims to discuss common women concerns from all ages and walks of life. We are already on our 14th leg of the HPV infection series. So for any questions for our speakers later, you may type them into the Q&A boxes of UP Manila live stream and Zoom, or the chat boxes of Facebook Live and YouTube. Our forum today will give us an overview on cervical cancer. Today, we will learn about the prevalence, risk factors, signs and symptoms, diagnostic options, treatment, and prevention of cervical cancer. So I know this afternoon will be a very fruitful one. To formally start our forum, I am honored to introduce our speakers. Here with us today are two of the respected and well-known gynecologic oncologists. We have with us Dr. Concepcion, Damaso-Rayel, and Dr. Merlind M. Montinola-Morales. Our first speaker is Dr. Concepcion Damaso-Rayel. Dr. Rayel is an esteemed alumna of the UP College of Medicine class of 1981. She is the head of Gynecologic Oncology section of Davao Doctors Hospital. She is also an honorary consultant in Southern Philippines Medical Center. While being active as a clinician, she also serves as professor at Davao Medical School Foundation and chair of PhilHealth Committee in Philippine Obstetrical and Gynecological Society. Dr. Rayel is also affiliated with international institutions like International Gynecologic Cancer Society and European Society for Gynecologic Oncology. Everyone, let's all welcome Dr. Concepcion Damaso-Rayel of Mu Sigma Phi Sorority Batch 1981.
Good morning. This talk is entitled Eliminating Cervical Cancer, a Fight We Can Win. This is a very ambitious goal, but it is not impossible if government, the private sector, the academe, and the general population work together. Many of my slides contain illustrations made by a talented group of doctors from our Oncology Society. Hopeful we can increase cervical cancer awareness. And why? In 2020, the Director General of the World Health Organization said that every 2 minutes, one woman dies of cervical cancer, a tragedy we can prevent. In our country, 12 women die of cervical cancer each day. For a preventable disease, these are sad statistics. A major reason is that women consult late. The most recent 3-year census at the Philippine General Hospital shows that 90% or higher are in the advanced stages. Cervical cancer ranks as the second most common malignancy among women in the Philippines, with more than 4,000 deaths in 2020. Figures may actually be higher if not for underreporting. Globally, it ranks as the fourth in women. We have seen the burden on our patients, their families, and the healthcare system. We will further discuss what causes it, what predisposes a patient to the disease, and how to promote early detection, the manifestations, and prevention. At least 3 persons contributed much to enhance our knowledge. Cells from the tumor of Henrietta Lacks continue to be used for research. George Papanicolaou introduced pap smear for cancer screening, and Professor Zurhausen demonstrated that HPV is the etiologic agent. His work paved the way for vaccine development. Almost all cases of cervical cancer are caused by HPV. HPV is a double-stranded DNA. 15 to 20 types are cancer-causing, majority from types 16 and 18. For the non-oncogenic types, 6 and 11 are the usual causes of anogenital warts. HPV is introduced through breaks in the cervical epithelium, as in trauma from sex. HPV causes DNA damage when its oncoprotein E6 binds to the host p53, inhibiting programmed cell death. Also, E7 deactivates the tumor suppressor gene retinoblastoma protein, hence proliferation is enhanced. This diagram shows that most HPV infections are transient. Only the persistent HPV causes cancer, and it takes years from low grade to become high grade lesions and eventually cancer. This provides us the opportunity to screen patients and to treat before cervical cancer develops. HPV is also implicated in other types of cancers like oral, penile, vaginal, vulvar, and anal cancer. Risk factors for developing the disease may be sexual or reproductive. They are somehow interrelated because of the high-risk HPV, early age at first contact and delivery, multiple sexual partners, high-risk sexual partner, many children, and sexually transmitted infections or prolonged oral contraceptive use. Medical and socioeconomic factors include immune suppression, HIV infection, smoking, low socioeconomic status, and absence of screening. Early age at sexual contact can be due to trauma or engaging in different forms of sex, and also because immature cells are actively proliferating. Age at first delivery is important, and the cause is usually trauma to the cervix or acquisition of persistent HPV. Multiple sexual partners increases acquisition of sexually transmitted HPV. A monogamous woman who has a promiscuous partner will be at risk. An uncircumcised male is another risk factor. First delivery is multiple deliveries increase trauma, risk of acquiring HPV, and exposure of the endocervical lining due to higher hormone levels. Other sexually transmitted infections may coexist with HPV, namely gonorrhea, chlamydia, trichomonas, mycoplasma, ureaplasma, herpes, and syphilis. Patients with HIV easily acquire persistent infection. Smoking is implicated in many forms of cancer. Nicotine and other metabolites are found in cervical mucus. They enhance cellular proliferation. The use of oral contraceptives for 5 years or more may increase a patient's risk, but whether it is due to more liberal sexual encounters or as an independent cause will require more controlled studies. We know that most lesions come from HPV infections, so those on the pill may have concurrent HPV. Low socioeconomic status is a major factor. Unschooled women, those working for daily subsistence, poor nutrition, and those with minimal capacity for screening are at great risk. The most important risk factor, however, is actually absence of screening. The World Health Organization has embarked on a strategy to curb cervical cancer. If by year 2030, 90% of girls are vaccinated by age 15, or 70% of women are screened for HPV from ages 35 to 45, and 90% of those with lesions are treated, the incidence will be cut in almost a half by 2045 and 97% by 2120, roughly about 2 generations. Screening strategies include HPV testing, pap smear or cytology, or a combination of both pap smear and HPV tests, and also visual inspection acetic acid. Screen and treat or triage those that are positive to additional tests like colposcopy before treatment. The American Cancer Society and the World Health Organization propose that HPV DNA test be the preferred screening method. HPV test every 5 years. Options for co-testing every 5 years or cytology every 3 years are recommended. These are methods for HPV testing. For cytology, we now have two methods, the conventional and liquid-based pap smears. These are methods for co-testing. Visual inspection acetic acid causes whitening of the abnormal epithelium because of coagulation of proteins. Signs and symptoms of patients will depend if the disease is early or late. These photos show early and late disease. Those above will manifest minimally, while those below will show more pronounced signs and symptoms. For early disease, the patient is generally asymptomatic. That is why routine screening is important. As the disease progresses, the patient may complain of abnormal discharge, irregular bleeding after sex, or between menses. In the late stages, patients may complain of pain, edema, changes in urinary and bowel function, weight loss, and fever. As prevention, the World Health recommends HPV vaccination, education tailored to age and culture, condom use, and male circumcision, secondary prevention, screening with HPV test, and treatment if HPV is positive. Tertiary prevention means treatment of invasive cancer. Let us help prevent and eliminate cervical cancer. Good day, everyone.
Sorry po for the technical difficulties. Thank you so much po, Ma'am Rael, for that talk. It's always a comprehensive talk from you po. So given the prevalence of cervical cancer in the country, we should all be mindful of its risk factors and symptomatology in order for us to diagnose it early. So for our viewers, kindly save your questions for our Q&A sessions later because we'll have our second speaker to discuss more of the topic. Speaking of the second speaker, she is Dr. Merlind M. Montinola-Morales. Dr. Morales is an acclaimed alumna of UPCM Class 2005 and a fellow of Philippine Obstetrical and Gynecologic Society and Society of Gynecologic Society. Currently, she is a training officer of Medical Center Manila, Manila Medical, and a medical specialist of other institutions, namely Quirino Memorial Medical Center and Taguig Pateros District Hospital. So everyone, let's give a warm welcome to Dr. Merlind M. Montinola-Morales of the Mu Sigma Phi Sorority Batch 2005.
Good afternoon. I'll just share my screen. So good afternoon again. I'm Dr. Merlind-Morales, and I will be discussing the cervical cancer diagnosis, treatment, and prevention. So first, to discuss the management of abnormal screening results, let us review first the natural history of HPV infection and progression to cervical cancer. So it takes about 1 to 2 years from the initial infection to mild cytologic abnormalities, which are detected by Pap smear. Persistent HPV infection can then lead to disease progression as a precancerous or premalignant lesion, also known as cervical intraepithelial neoplasia, which can lead later on to invasive cancer if untreated. So this process can take a long time, in several years or about 10 to 20 years. Cervical intraepithelial neoplasia or CIN is classified according to its severity. So low-grade lesions are mild dysplastic lesions and corresponds to CIN1, which only affects 1/3 or less of the cervical epithelium. Eventually, low-grade squamous intraepithelial lesions can advance to high-grade squamous intraepithelial lesions, which corresponds to moderate and severe dysplastic lesions, which involves a greater part of the cervical epithelium, from more than 1/3 to the whole epithelium. So this may eventually progress to invasive cancer. So in this window of the development from mild to severe dysplasia, should we put our efforts on screening our women in order to prevent the development of cervical cancer? One way of screening our women is by Pap smear, as discussed already by Ma'am Connie. So this is the Bethesda system of reporting Pap smear findings. So the most common are the squamous cell abnormalities. For the squamous cell abnormalities, we have the ascus, the L cell, and the H cell. So these squamous cell abnormalities differ in the risk of the development to severe dysplasia and cancer. So ascus and L cell have the lowest risk, while H cell has the highest risk of developing into cervical cancer. So this slide shows the risk of CIN3 or cancer development of the different squamous cell abnormalities. So the risk is greater for those who are high-risk HPV positive by screening. And thus recently, it is important to know the high-risk HPV status of patients whenever this test is available and whenever it is possible if the resources permit. So in ascus, if the woman is HPV negative, the risk of developing into CIN3 or greater is only 0.4%. But if she is HPV positive, her risk increases to 6.8%. Likewise, in HCell, the risk of having CIN3 or cancer is 29% for HPV negative women, but is 50% for HPV positive women. So what do we do if we get these abnormal pap smear results? So in general, for lower grade lesions such as the ASCUS and the LCIL, we can just do repeat testing after 1 year. However, colposcopy is indicated for HPV positive patients. But for higher grade lesions such as the HCIL or the ASC-H, all patients should be referred to colposcopy regardless of the HPV status. And for HCIL, the patient may undergo treatment with excision immediately. So colposcopy is examination of the cervix through the use of a colposcope, which is a low-power binocular microscope with a magnification of 3 to 15 times. Dilute acetic acid solution is applied to the cervix and the transformation zone is evaluated for the presence of dysplasia or abnormal areas or abnormal vessels. So this is a picture of a cervix before and after application of the acetic acid. So we are able to see the aceto-white areas pointed by the red arrows, and these are the areas of cervical dysplasia. So mild lesions have less distinct acetowhitening, while severe lesions have raised edges and greater degree of acetowhitening. And cervical cancer may appear as gross cervical masses with friable, necrotic, and hemorrhagic areas. Cervical punch biopsy is done on these lesions seen on colposcopy and submitted for biopsy. So the biopsy then confirms the diagnosis of CIN1, CIN2, CIN3, or invasive cancer. So how do we manage them? So for CIN1, since this is only mild dysplasia in general, we can do follow-up with no treatment. But for CIN2 or CIN3 with moderate to severe dysplasia, the recommendation is to do a diagnostic excisional procedure or to remove the cervical lesion. So this management is management in general and can be different for pregnant patients and young women less than 25 years of age. So these are the methods for diagnostic excisional procedure. So we have the LEAP or the loop electrosurgical excision procedure and the cold knife conization. So for the LEAP, we make use of a loop electrode attached to an electrosurgical unit to excise the transformation zone. For the cold knife conization, a scalpel is used to excise a cone that will cover both the transformation zone and the endocervical canal. So the LEAP can be done as an outpatient procedure, while the cold knife conization requires admission and regional anesthesia. So the specimen for the LEAP and the cold knife is then sent to the laboratory for examination and checked for the presence of invasive cancer. So next is the diagnosis and management of cervical cancer. So first is to determine the stage of the cancer. So previously, cervical cancer is clinically staged, but in 2018, it is revised to allow imaging and pathological findings where available to assign the stage. So the first step in staging is clinical assessment by a comprehensive physical examination, which includes palpation of the neck and inguinal nodes, abdominal examination, and pelvic and internal examination. Next is through the use of imaging. So the revised staging permits the use of any of the imaging modalities according to available resources. So transvaginal ultrasound can have good accuracy in the hands of an expert operator. CT scan is a more accurate diagnostic tool than ultrasound to detect parametrial invasion with its soft tissue contrast. MRI is the best method to determine the primary tumor volume, vaginal invasion, parametrial involvement, and bladder and rectal involvement. PET-CT scan is a more accurate tool in detecting lymph node metastasis, extrapelvic metastasis, and recurrence after cervical cancer treatment. So if there are enlarged nodes or extrapelvic metastasis by imaging, fine needle aspiration biopsy, laparotomy, or laparoscopy may be done to rule in or rule out metastasis. Additional procedures include chest X-ray or chest CT scan or cystoscopy or sigmoidoscopy if the patient is symptomatic or if with suspected bladder or rectal involvement. This is the Figure 2018 staging of cervical cancer. So for stage 1, the cancer is strictly confined to the cervix. So the staging is further broken down to substages as follows, depending on the size and the invasion of the tumor. So stage 1A is microscopic cervical cancer diagnosed after deep or cold knife conization. For 1B, the tumor has measurements more than 1A or with a visible cervical mass, but this mass is only confined to the cervix. Stage 2 cervical cancer is when the cancer invades beyond the uterus, either to the vagina or the parametria. So for stage 2A, it involves the upper two-thirds of the vagina, and stage 2B is with involvement of the parametria. In stage 3, the tumor has extended to the lower one-third of the vagina or to the pelvic wall, causing hydronephrosis or involvement of the lymph nodes by imaging or histopathology. Stage 4 is when the tumor extends beyond the true pelvis or to the adjacent organs such as the bladder anteriorly or the rectum posteriorly or distant organs such as the lungs and the liver. So what is the treatment for cervical cancer? So the primary treatment of early stage cervical cancer is either surgery or concurrent chemotherapy and complete radiotherapy. So complete radiotherapy includes external radiotherapy and vaginal brachytherapy. And surgery may be offered for stage 1A, 1B1 to 1B2, 2A1 and 2A2. So these are cervical tumors confined to the cervix with or without involvement of the upper vagina, but with tumors less than 4 centimeters. So for late-stage cervical cancer, all other stages beyond those enumerated above, the primary treatment is concurrent chemotherapy and radiotherapy. So this is the machine for external beam radiotherapy. And then for brachytherapy, the radiation is delivered internally by inserting the source through the vagina near the cervical tumor. And then chemotherapy is done weekly during the radiation therapy. So how about the prognosis? So the prognosis of cervical cancer is shown in this slide. So the 5-year survival decreases as the stage increases. So for stage 1, the 5-year survival is 80 to 93%, but for stage 4, the 5-year survival is only less than 16%. So in our country, we usually get them already at the late stages of the disease at stage 2 to stage 3 to 4, which is why we need to strengthen our efforts on cervical cancer screening and, more importantly, in cervical cancer prevention. So how can we prevent cervical cancer? So this was already mentioned earlier by Ma'am Connie, but I would like to reiterate them once again. So this is an infographic from the Society of Gynecologic Oncologists of the Philippines. So preventing cervical cancer is by practicing mutual monogamy, use of condoms, HPV vaccination, and regular screening by pap smear, visual inspection with acetic acid, or HPV testing. So HPV vaccines provide a strong protection against HPV infection. It is not used to treat an existing HPV infection and other diseases caused by HPV. And thus, it is used to prevent infection but does not cure an infection once you have it. HPV vaccines offer the most protection when given early. So it is routinely recommended at 11 to 12 years old, up to 26 years old, but may be given as early as 9 years old. And it may also be given for the older age group of 27 to 45 years old, but they may benefit less from the vaccine since they may have been already exposed to HPV. Males can also get vaccinated since they may also develop cancer of the mouth and throat, anal, and penile cancer. So vaccination can also reduce the spread of HPV that causes cancer to other people. So we have 3 vaccines available in the market, and all of the 3 vaccines prevent infection with HPV types 16 and 18, which are the most common high-risk HPV types. So the quadrivalent vaccine has additional protection for HPV 6 and 11, which causes genital warts. And the newest vaccine prevents HPV infection against an additional 7 more high-risk types. And the timing, the indication are almost the same for all the vaccines, and the timing of vaccination varies depending on the type of vaccine. So widespread HPV vaccination has the potential to reduce cervical cancer incidence around the world by as much as 90%. And eventually, the vaccines may reduce the need for screening and subsequent medical care, biopsies, and invasive procedures associated with follow-up from abnormal cervical cancer screening, and thus helping to reduce healthcare costs and anxieties related to follow-up procedures. So for my last slide, the cervical cancer is caused by HPV infection. Most women will have HPV infection during their lifetime, but only a few develop cervical cancer depending on the presence of risk factors. Cervical cancer is a preventable disease. It can be prevented through HPV vaccination and cervical cancer screening. And prevention is still the best cure. So it should be our fervent goal to decrease the burden of cervical cancer in the Philippines and decrease the mortality caused by cervical cancer. So May is the Cervical Cancer Awareness Month, and in celebration of this month, our society, the Philippine Society for Cervical Pathology and Colposcopy, is holding a nationwide cervical cancer screening day with hybrid lay information sessions through Facebook on May 20. And we would like to invite everyone to this activity, especially our patients. So thank you for the opportunity and good day.
Thank you for your very comprehensive talk, Dr. Morales. Indeed, prevention is always better than cure. So we highly recommend that our patients and our audience get vaccinated against the human papilloma virus. Knowing what to watch out for and what to do in case you have cervical cancer related symptoms would allow us to address pre-malignant lesions of the cervix or early stage cervical cancer, which is treatable. So this is what we always want to emphasize. Early stage cancer is still treatable. I know everyone is excited to ask their questions from our speakers, but let us first hear from our STEAM reactor. To give us some of her insights on today's talks, we have Ms. Reese Rayos. Ms. Reese is a graduate of Marketing Management in De La Salle University. While being busy with her full-time job, Ms. Reese also enjoys her passion in enjoying good and delicious food through her very own blog and social media page, The Foodie Station. Without further ado, let's all welcome and hear Ms. Reese Rayos.
Hello. Hi, good afternoon, everyone. So, well, first and foremost, I want to thank everyone for inviting me today. And basically, talagang ang dami kong natutunan dito sa program na to, no? You know, as a woman and of course, yung mga family natin and friends na hindi wala or masyadong alam or guidance about this kind of topic. This is something talaga that I really am excited to share. Kasi ito yung mga bagay na minsan nakakalimutan na lang natin or nadidisregard. So, yung mga diniscuss kanina, including all the possible mga symptoms, yun yung mga talagang minsan hindi ko ina-expect na pwede pala mag-lead to something like that, diba? So, I'm really thankful na meron tayong mga ganitong guide na pwede nating, you know, maging basis for, na hindi tayo maging parang nagwawalang bahala na lang tayo. Kasi at the end of the day, health natin ito. And you know, of course, health is wealth. Ito yung magiging the source of kung paano natin magiging how will we be able to run our lives, pati yung sa mga, of course, our future, 'di ba? So, nakadepende to dun sa health natin. And at the same time, hindi tayo dapat maging scared kung ano yung mga prevention and ano yung mga pwedeng treatment na, that we can actually do at the end of the day. Kasi at least meron tayong magiging, it's something na pwede nating maging, yun yung light at the end of the tunnel, na hindi tayo pwedeng ma-depress kung meron tayong naging ganitong mga symptoms sa ganito, or nandito tayo sa point na tayo mismo is may ganitong karamdaman, because meron tayong mga pwedeng gawin. So, huwag tayong matakot. Yun lang naman yung natutunan ko for this session. So, I have other questions, pero sige later, once we have the questions na rin from our audience. So,
Thank you very
that's
much,
it. Thank you.
Ms. Reese. You're right, no? Health is wealth, and we should never be afraid because we have control over our own health. So thank you
Exactly.
once again to our speakers, Drs. Rayel and Drs. Montinola. I know we can already entertain questions from our audience. So just a reminder to everyone that you may type in your questions into the Q&A boxes of UP Manila live stream and Zoom, or the chat boxes of Facebook Live and YouTube. So for our first question, this is addressed to Dr. Rayel. Dr. Rayel, of all the symptoms that you mentioned a while ago, what do you think po is the most alarming or is the most common reason for consult among women?
Morning, and thank you for the question. Usually patients come in for abnormal discharge, but it does not necessarily mean it's cancer, because sometimes it's also due to infection. So I would consider abnormal bleeding as the more alarming sign. When we say abnormal bleeding, it may be just trickles after sexual contact, or it can be bleeding in between menses, sometimes prolonged bleeding before menopause or even after menopause. And patients often blame this as menopausal signs, which should not be, because you have to make sure first that she's not developing a lesion in the cervix rather than blaming it on menopause. I think that's it.
Yes, so usually it's the bleeding that's very alarming po, no? I also see a lot of patients, especially those who are postmenopausal. Now, usually they are being managed by OBGYNs with they are just being told, yes, they're just being told, oh, baka menopause ka na. And then they usually listen to yung mga kapitbahay. Payo ng kapitbahay, siguro nagme-menopause ka na, so baka hindi pa yan kailangan. In relation to this, Doktora, you said they're usually managed with hormones. So this takes the form of oral contraceptive pills. Would you actually recommend continuous use of OCTs, or does this increase the risk of cancer among women?
Yes, I mentioned earlier that the risk is increased, but there are two things that one should know. One is that lesions in the cervix are usually because of persistent HPV, more than 95% of the time. The second thing we should know is that when we use oral contraceptives, these are hormones, it facilitates eversion or exposure of the inner lining of the cervix. We call the endocervical lining. So when it is exposed because of hormones, the body is very intelligent. It tries to protect it, and then it changes into another cell type, or it multiplies. So during this time, it is most vulnerable to HPV infection. Now, the World Health International Agency on Research on Cancer mentioned that there is about 4% risk of developing cervical cancer for been using the pill for more than 5 years. But these were found in women with concurrent HPV. So the question really now is it because of the HPV, or is it because of the exposure of the endocervix that enhances HPV gene expression? Or is it an independent thing merely because of the use of HPV? I think we need more controlled studies for us to draw conclusions. So the question now is, should we still recommend oral contraceptive use? Yes, because the main reason for oral contraceptive use is really for family planning. Okay?
Okay. So yes, we can still use OCTs. So I guess this only emphasizes the fact that even if we are on OCTs, it will be more important if we become screened. Right, Doktora?
That's right. Because when you're on the pill, you may also have concurrent HPV infection, which may be the reason for the increased risk.
So we have a question. So I guess I could direct this question to Dr. Morales. What do we do to patients above 30 years old with persistent positive high-risk DNA type for more than 2 years with normal cytology and, well, same situation in the 50 years old? I guess we need to address first a 30-year-old with persistent positive HPV high-risk type for more than 2 years with normal cytology.
Okay, so if we have a persistent HPV DNA, HPV, high-risk HPV for two consecutive, diba, 2 years with a normal cytology, the next step is to do colposcopy for these patients. And then if you note any lesions that warrant biopsy, so you perform the biopsy and then you treat according to the results of the colposcopy. It's the
Doctora,
same for 50 years old.
Yeah. Okay, so it's the same regardless, no, if you're age 30 or age 50, as long as you have a positive high-risk DNA type for more than 2 years, then you need to undergo colposcopy. As
Yes.
Dr. Rayel mentioned a while ago, it's the persistent type of the HPV that could actually progress to cervical carcinoma.
Yes, that's
Okay.
correct.
So the next question, ito madalas, is there a possibility na magkaroon ng cervical cancer ang babae without any relationship or sex with men? NBB, no boyfriend since birth. And what could be the possible explanation for this?
Is that for both of us?
Can I get your opinion, Doktora?
The usual cause is really penetrative sex. But it's not exclusive to that because sexual practices nowadays are so different. You can have hand to genitalia, saliva. You have other forms of methods by which you can get the HPV. In fact, there are some anecdotal reports sharing of razors. Okay, so these are what we call fomites. So there are other ways by which you can acquire the HPV and not exclusively to penetrative sex.
Okay, so that's true, no? So in addition to what Ma'am said, so majority talaga of cervical cancer, more than 99%, is caused by HPV. But remember that we also have the less than 1%, which is not related to HPV. And this can also cause cervical cancer. But majority of them talaga, it's really the HPV.
Ms. Reese, do you have any inputs on this or do you have any further questions?
Yeah, actually, I have I have two questions. Number one, I remember kasi before I had cervical vaccine. Kaya lang hindi ko na complete. Diba parang how many batches ba yun na i-inject? What if hindi siya natapos? Is it okay if I repeat the whole thing again? Or pwede ba yung last injection na lang or last vaccine na lang or dose? Or I need to restart from the start po?
Dr. Rayel?
When we started giving the vaccines years ago, we needed to follow the schedule of 0 to 6. We could be late for a few weeks, it was acceptable. But nowadays, the recommendation is that when you forget the third dose, you give it as soon as you remember. You don't have to repeat the same cycle. You don't have to repeat the cycle of 3 doses, but preferably within the year.
Okay. So kung matagal na po yan, Doc, kailangan.
Miss Reese, mga gaano katagal?
Yun nga paano kung matagal na talaga yung, as in like years na, hindi na siya within the year.
That means you don't get any more the maximum benefit of reaching the antibody level that is protective. Okay, so you can give it, but then don't expect it to be 80% effective, for instance.
Yeah.
And besides, we really give it, it is really being promoted or advocated for patients who are younger because the antibody titers are higher and they produce quality antibodies. When we give it to older patients, we just call it, the term we use is catch up. For those HPV types that you have not been exposed to, you can still be protected, but not for the types that you have been exposed to. Meaning, if you delay completion of your vaccination, that means you expose yourself to more HPV types, high-risk types, and you won't receive the maximum protection anymore.
Okay, so I guess, Ms. Reese, you can always get the catch-up dose, but that would mean that if you got it at a later day or a later date, you won't get the maximum benefit. So to get the maximum benefit, the scheduled dose would be at 0, 2, and 6 months, right, Dr. Morales?
Yes.
That's correct. So I agree with what Dr. Rayel said. So it is important that to achieve the maximum benefit, you follow the recommendation. And kung years na talaga, how many doses ba yung na-receive mo? 2 doses ba or 1 dose lang?
Yeah. Well, actually, it's more on, actually, it's not me naman. I'm just asking kasi, of course, di ba the vaccine naman din is not that, it's really pricey at some point, diba? I mean, not for all people naman na kaya nila ma-afford all the 3 doses. So, kumbaga, the question is, because definitely not everyone can afford to get everything and magawa nila on yung schedule na yun. Kaya talagang the support of the government, especially for those of our the women out there na hindi afford, kailangan meron talaga tayong support, diba? Otherwise, talagang mapupunta tayo sa sitwasyon na hindi lahat nakuha yung tamang dosage.
So in addition to that, that's why it's recommended na mas early yung vaccination.
Yes.
At as early as 9 years old para they are not exposed yet to the virus. And if you're able to give at less than 15 years old, you can just have 2 doses. So mas tipid siya. And then the patient will have the protection against HPV. And in addition to that, yes, I agree, mahal talaga yung vaccine. So it's better sana that it's included in our national plans. Pero as of the moment, hindi pa siya kasali. Siguro pag yung universal health care law will be implemented, siguro that's the time when we can include cervical cancer vaccines to be given to the general population.
I guess we have to thank Dr. Rayel for this because she is one of those who's really lobbying to have these vaccines included as well as the screenings. Okay, we'll entertain another question. I've heard about cryotherapy of the cervix from other clinics. Is cryotherapy recommended immediately once minimal lesions have been detected upon visual inspection of the cervix with acetic acid? Dr. Morales?
So cryotherapy, so it can be used. So it is common. So if you hear about the see and treat approach of cervical cancer screening, so in the Philippines, so if we get, like for example, a positive VIA, in low resource settings where cryotherapy is available, but we don't have the benefit of having a biopsy or a laboratory for biopsy. So it's sometimes employed in our setting. So we can do that. However, in cases where you have a higher what do you call this, a higher grade lesions and those that can harbor a possible microinvasion, we cannot detect that or we cannot address that by just cryotherapy. So where available, so in settings where we have a laboratory and we have the equipment, so for lesions of the cervix, which seems to be of a higher grade um, in appearance, so it's better to perform or refer the patient for colposcopy. For low resource settings, yes, we can do the cryotherapy.
Napaisip tuloy ako, Doktora, kung ano yung available sa amin. Kung cryotherapy or colposcopy. Because, well, unfortunately, no, there are areas where both are not actually available. Sometimes you need to go to a tertiary hospital to get a colposcopy done. And then it would depend on how advanced is the clinic if they also have a cryotherapy.
May I add, Dr. Gladdy?
Yes,
May I add to this? The World Health actually advocates two strategies: the screen and treat, the screen, triage, and treat. The screen meaning after a visual inspection acetic acid in low resource settings, then the government, our government, allows treatment in one sitting instead of losing these patients. But of course, it is ideal to have the screen, triage, and treat, meaning when you see an abnormality, acetowhitening in the cervix, you decide already to triage, send for colposcopy, so a biopsy can be done and proper treatment is made. So there are two ways by which we can approach. In our setting, it's a low resource setting, so the government already embarked on the screen and treat method. But whether we will change to screen, triage, and treat, we will see later. Thank you.
Thank you, Doktora. In relation to this, no, so as we've mentioned, it's not really ready available, and then we still need to decide on which approach we want to do. Would you recommend, Doktora, seeing immediately a gynecologic oncologist or someone who's been trained for colposcopy or well, visual inspection with acetic acid? What are your thoughts on this?
I'd like to answer that in a different manner. Okay. In 2019, during the Asia-Oceania Convention in Manila, the Manila Declaration was started. This was really to address the problem of cervical cancer. It involves the DOH, the POGS, our society, and its specialties. And then they made a roadmap from primary screening, secondary, and tertiary screening. Certain organizations were assigned to primary screening, secondary screening. So in the secondary screening, like for instance, under SECAP, they train, they identify healthcare workers in certain regions and train them in the screen and treat method. In the tertiary setting, of course, the gynecologic oncologist is needed because this is cervical cancer and has to be treated by a subspecialist. But right now, the help of the government is that SGOP, POGS, and DOH are working hand in hand so that we can have a Z package for cervical cancer. So now going back to the question, in areas that do not have the expertise, there are point persons in particular localities who are trained in the screen and treat method. Okay, thank you.
Thank you, Doktora. So our takeaway point is that it's not an excuse if you don't have a specialist in your area. It's not an excuse to not get screened, because we also have individuals who have been trained by the government and by this specialist to address our needs. So you just need, I guess you just need to ask your locality where these services are available. Parang ang daming questions po no on prevention and screening. So this simply reflects that a lot of people still don't know what to do. Let's address naman po questions regarding patients with cervical cancer. Dr. Morales, for early stage cervical cancer, some doctors say that you can no longer, parang someone has been diagnosed with cervical cancer. She knows it's early stage, but her doctor said she could no longer undergo surgery. Is this really possible? Is surgery really not an option?
Depends kung the doctor is a specialist. Is her doctor a gynecologic oncologist? So, if for that, I think it would be needed that she seeks a specialist opinion of that, and so that the oncologist or the specialist can perform examination as well as the diagnostic evaluation that are needed in order to say if the patient is a candidate for surgery or not.
Actually, surprising, no, Doktora? Kasi usually, ang alam ko, pag may nakitang bukol, tinatanggal agad. Diba? So, that's something new. Anyway, will cervical cancer patients still be able to get pregnant?
Depends on the stage of the cancer, diba? So for early stage, yung mga microscopic cancers, we can just do conservative treatment. We can preserve the fertility and they can still get pregnant. But for the advanced stages of cervical cancer, so the recommendation would be to be treated right away with radiotherapy and chemotherapy. And if that is already given, then unfortunately the patient will not anymore conceive. But you can have we have parang nowadays we have the technology to preserve our ovaries or the oocytes. Prior to the treatment of cervical cancer, you can have your oocytes preserved before undergoing the treatment, so that in the future you can or if you have a husband right now, so that can be you can undergo IVF or in vitro fertilization. Pero the yun. Pero of course, 'di ba? So eventually siguro a surrogate will have to carry the pregnancy eventually, but it meron pa siyang ethical issues in our
medyo sensitive
country.
yung
Medyo it's a sensitive topic.
But in general, Doktora, patients with cervical cancer, if they are not on early stage, they could not get pregnant, I guess, because of the treatment that they'll be receiving, which, as you've said, is in the form of chemotherapy and radiation. But for selected few cases, I guess fertility can be preserved, but this would be in the form of in vitro fertilization, cryopreservation. Right, Dr. Rayel? What are your thoughts on this?
We have such a thing as fertility sparing procedures. Generally, they are reserved for very young patients, very early disease. Instead of really treating with radiation or removing the entire uterus and ovaries, you just remove the cervix. So the patient can still get pregnant because she still has the ovaries and the body of the uterus. But these are really very selected cases. Not all will qualify because there are stringent criteria. But if the question is it still possible The answer is yes. Now for late disease, we know that the management is really radiation and chemotherapy, which can really render the ovaries inactive and the endometrial lining. So the option would really be for young patients to have their ovaries, as mentioned by Meng, or the eggs cryopreserved. But whether they resort to surrogacy or not, it is not acceptable in the country as of the moment. But in other countries, since it is acceptable, then the answer will still be yes. They can still get pregnant.
Yes, in
Thank
very
you.
few selected cases. Thank you, Dr. Rayel. Pansin nyo, parang kami, very hesitant in answering that question because that is already a very specific and very particular condition that would actually require
Legal.
in-depth discussion with the family, actually not only the patient but also the husband and the family involved. And it has ethical and legal issues attached to it. No, Miss Reese, do you still have any further questions for our speakers?
Yes, one last na lang po, no? If ever po nag-undergo na ng treatment yung po person with cervical cancer, what are the chances that the cancer will, bumalik yung cancer?
So after treatment, so there is really a tendency, a risk for recurrence talaga. And yung risk of recurrence is dependent on kung tama ba or appropriate or within the time frame na bigay yung treatment. So if you have parang delays in the treatment, so kunyari in the radiotherapy and the chemotherapy, so the risk of recurrence is greater. So that is why after treatment, so it's still necessary to still have a regular checkup with your doctor so that you can monitor and catch early if there are recurrences para it can be treated right away.
Okay. We still have a lot of questions in our live stream. However, due to limited time, we need to cut off the discussion. But we promise to address each of your questions. Thank you once again to our speakers, Dr. Concepcion Damaso-Rayel, Dr.Merlind Montinola-Morales, and our reactor, Ms. Reese Rayos. Thank you for sharing your expertise and thoughts with us. But of course, before we end our forum for today, may we have your last habilin to us for those who are very interested in both the pre-malignant and the pre-malignant lesions of the cervix and cervical cancer. Ano po ang maipapayo nyo sa amin? Dr. Rayel?
In all my lectures, I always label cervical cancer as a cancer you can stop. What do we mean by that? If we screen early and we detect that there is an abnormality, we can do much about it. If the patient already has pre-cancer, we can treat the patient. She does not have to develop cervical cancer. And it takes years for this to happen. So all we need really is the cooperation of the general population of women to come in for screening and wellness, and also for the attending doctors to be vigilant, and also for networking among agencies like government, private institutions, and the academe, not only for education, but also for extending the necessary services. So let us all work hand in hand to curb this disease. Thank you.
Thank you very much, Dr. Rayel. Dr. Morales?
Okay, so first and foremost, so really cervical cancer is a preventable disease. So actually, first and foremost is really cervical cancer awareness. So it should be our advocacy as health workers, and also then that we spread cervical cancer awareness to our patients. Okay, so by that time, okay, so it starts with awareness, and then possibly then if we could disseminate this information to all our um, fellow women, so they will by themselves they will consult or subject themselves to cervical cancer screening and and HPV vaccination um, in order to prevent the development of cervical cancer. So that's it.
Miss Reese, would you like to add some key points for our participants?
Okay, well, again, um, as citizens, of course, we are all, and of course, we are all responsible for our health, no? So, again, the general public should not be scared, given that we have all this, information available for us to learn about. So let's not just keep it to ourselves as much as possible. Let's share it as well to those people, lalo na yung sa mga walang access to this kind of information. So it's our responsibility to ourselves and of course to our community. That's it.
Okay, thank you very much to our speakers and Reactor. We can stop cervical cancer. It doesn't only take individual responsibility, but vigilance, political will, and a strong government support to address cervical cancer. So tulong-tulong sa pagsugpo sa anumang cancer. Tama po ba? So before we end, we, the MU webinar team of the MU Sigma Phi Medical Sorority, would like to express our gratitude to our partners, the UP College of Medicine, the Philippine General Hospital, the City of Manila. This event would not also be possible without our co-presenters in Life Heroes and the Mu Sigma Phi Foundation. Our co-sponsor, Merck, Sharp and Dome, and our official media partner, our awesome planet. We are also grateful for the unwavering support of UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. Again, we remind all healthcare professionals who are interested in obtaining CPD units to please fill out the evaluation form at the link provided within 3 days after the forum. You may find the links to the evaluation forms at the comment boxes of Facebook Live, YouTube, and chat box of Zoom. We would also like to invite you to the last forum of our webinar series on June 14, 2022, Tuesday, from 12 to 1 p.m. entitled Teenage Pregnancy, Nene is Now a Mother. Murang edad ng pagbubuntis, nanay na si Nene, which aims to address health concerns associated to teenage pregnancy and ways to ensure best outcomes for both our young mothers and their child. For this webinar, we will have Dr. Emma Llanto and Dr. Geraldine Toralba as our speakers. And this will also be moderated again by yours truly. So thank you very much for all your support for our past webinars. See you again all this June and have a good day.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital, and City of Manila. Again, the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum is co-presented by the In Life Heroes and the Mu Sigma Phi Foundation, and co-sponsored by Merck, Sharp and Dome. And this event is covered by our official media partner, our awesome planet. We are also grateful to the UP Manila Information Management Systems and UP Manila Postgraduate Institute of Medicine. Most of all, we thank you, our participants, for spending your lunch hour with us. For those who are interested in obtaining CPD units, please fill out the evaluation form at tinyurl.com/MUwebinars2021 eval. Please ensure that your answers are submitted within 3 days after the webinar. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber and tinyurl.com/immunityviber2 for the recently launched new set on getting your COVID-19 booster shots for Viber, and at tinyurl.com/immunity-tg for Telegram. For more details and updates, please check our Facebook page at facebook.com/MUwebinars and our Twitter timeline at twitter.com/MUwebinars. You may also email us at mewebinars2122@gmail.com. Before we end, we would like to invite you to the next leg of the Mula kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum on June 14, 2022, Tuesday, from 12 to 1 p.m., entitled Teenage Pregnancy. Nene is now a mother, or Murang Edad ng Pagbubuntis, Nanay na si Nene, which will discuss ways in ensuring best outcomes for teenage mothers and their babies. The speakers will be Dr. Maria Geraldine Assumption Gavina Castillo Torralba and Dr. Maria Emma Alesna Lianto, and to be moderated by Dr. Gladdy Maura Facun. And likewise, we would like to invite you to participate in our year-long Women's Health Forum series. Thank you very much for attending this webinar. Have a good day.